Hello, Dr. Ivanova and staff. My name is John Higgins, and I'm going to be presenting a project proposal to you today on improving the line of duty process. This is an overview of what I will be going over today. So what is an LOD determination, and what are the objectives of an LOD determination? A line of duty, or LOD, determination is a finding made after an investigation into the circumstances of a member's illness, injury, disease, or death. The finding is utilized to determine a member's eligibility for certain government benefits. However, a member who dies or sustains an illness, injury, or disease prior to service while absent without authority or due to misconduct, they are not eligible for certain government benefits. Therefore, the LOD finding or determination is used to determine those three circumstances. The bottom line is that the LOD determination protects the interests of both the member and the United States government. Because of this, LOD determinations must be made within a certain time frame, and that's established by regulatory guidance. As I previously stated, LOD determinations are made to develop a finding of duty status, and that duty status can impact an employee's or an employee's family by delaying their access to government benefits such as disability pay, retirement pay, enlistment extension, veteran benefits, survivor benefit pay, education assistance, emergency health care, and medical benefits. Any delay in the LOD processing or the outcome of an LOD will delay access to all of these government benefits. So, how compliant are we with the regulation, and where are we now? Well, as you can see on the slide, currently it takes us over 120 days to complete an informal LOD and over 180 days to complete a formal LOD. However, the regulatory guidance states that we must have informal LODs completed within 90 days, and it also states that we must have formal LODs completed within 160 days, and this would be both less than 90 days and less than 160 days, so those are our maximums. Both the formal and informal LOD determinations need to be processed faster for us to be in compliance with regulatory guidance. So, the impact on the organization. The delays in LOD completions results in a low patient employee satisfaction score, an overall decrease in morale, as that word tends to spread around, and a decrease in unit readiness that is below the regulatory guidance. Also, continuous rework is constantly being required, and patients who do not have completed medical packages are sitting at about 80% right now. The organization and customer impact, along with the implementation time required, are the most important factors in consideration of a project for our organization. Improving the LOD process meets those required organizational factors by satisfying both the organization and the customer requirements while also meeting the short-term time requirement that's needed for implementation of a project. Improving the MedCon process is prioritized as a close second, but as you can see, it is not the short-term win that the organization requires. This improvement project will result in a 25% reduction in current wait times for informal LOD completion, a 12% reduction in current wait times for formal LOD completion, a reduction of overall medical package errors by 10%, an increase in unit readiness by roughly 8% to 80%, and we will ultimately benefit by this project because the unit will meet regulatory standards for both unit readiness and LOD completion times. Even more important though, the employees and the patients will have an increase in morale and satisfaction and know that their voices are being heard through the surveys that they have been conducting. So the project is broken down into 5 phases, and each phase has deliverables that's associated with it. Phase 1, the team will define the current process state. The team will produce value stream maps, brainstorm, and affinity diagrams during this phase. And in phase 2, the team is going to collect the data for the time that we need. The team is going to produce critical to quality satisfaction survey results and cause and effect matrices in the phase 2. And in phase 3, the team will develop solutions to any identified problems. In this phase, the team will produce a refined process map showing the solutions. And in phase 4, the team will manage the implementation and the execution of those solutions, and they will produce an updated process map and satisfaction surveys. In phase 5, the team will monitor the progress over a 1-year period. Meeting minutes and project reports, however, will be given at each of the phases throughout phase 1 through 5. The project quality plan is intended to assure that the project work is accomplished according to specifications, standards, and applicable regulatory instruction and guidance, and that the deliverables meet the acceptance criteria. It documents the government standards that must be referenced and met during the performance of the project work. In addition, this plan contains written procedures for utilizing various quality tools and techniques. For this project, we will be utilizing Air Force Instruction 362910, the LOD determination dated 8 October 2015, and that's the governmental regulatory compliance instruction which defines the quality standards of LODs that are relevant to this project. All quality metrics and measures for standards for this project will be derived from AFI 362910, and this includes all time and quality standards as written in the 362910. AFI 38101, Manpower and Organization, which is dated 1 January 2017, is the governmental regulatory compliance instruction which defines the standards for organization within the United States Air Force. So that's going to tell us all of our manpower and staffing data. All process improvements relating to staffing and organization will be derived from that regulation. This includes following the prescribed organizational charts as defined in the 38101 and Air Force Instruction 38401, Continuous Process Improvement, dated 15 April 2016, is the governmental regulatory compliance instruction which defines the quality standards of personnel conducting process improvement projects. The project manager and team leader will be Greenbelt certified as defined in a 38401. All improvement deliverables will be standardized utilizing standard Six Sigma tools as defined in AFI 38401 and AFI 9201. The Air Force Inspection System, dated 11 February 2016, is a governmental regulatory compliance instruction which defines the quality standards of inspections and audits that are relevant to this project. All inspections and audits will be conducted utilizing the Air Force's Management Internal Control Toolset and the Inspector General Management System as a reference. Additional inspectable areas can be added to the inspectable areas that are defined in the 9201, but those inspectable areas that are defined in AFI 9201 cannot be subtracted or replaced. All report deliverables will be standardized utilizing that guidance as found in AFI 9201. The work breakdown structure diagram presents an outline of the work steps to be accomplished and the individuals responsible for each assigned task. The responsibility assignment matrix that's displayed provides detail on which activities are assigned to each individual member. As you can see, the P indicates that the member is the primary person responsible, while the S indicates that the member is the secondary person responsible for that respective work task. The network diagram picture displays the sequential order of tasks. Note that the critical links are the boxes highlighted in red, and the non-critical links are highlighted in blue. The Gantt chart depicted here displays the work tasks in order plotted along a timeline, identified who is responsible for each task, the task duration, and the dependencies. The resource usage sheet displayed depicts the number of hours of work required per task for each member of the project team. There are no material costs related to this project, and therefore they are not depicted. The estimated activity cost represents the activity costs that are associated with each activity and the estimated labor costs assigned to each team member to that activity. The risk register matrix depicted here identifies the risk, the potential impact, and the likelihood and impact if it occurs. The register also displays the courses of action to mitigate the associated risks. Numerical values here are assigned for the likelihood, impact, and the total rating prior to the mitigation and then post-mitigation. As depicted, the risk that the project needs to be most concerned with here is the patient survey not being completed. So in conclusion, the proposed implementation of a project to improve the LOD determination process will reduce current wait times and increase unit readiness satisfaction scores and further provide an annual cost savings to the unit. This project represents the greatest return on investment for the unit by requiring a short period of time to execute and costs only associated labor hours. At the end of this project, the organization will have implemented a process improvement that results in an increased readiness rate above 80%. Informal LOD times, which are 25% faster at turnaround, and formal LOD times, which are 12% faster at turnaround. And here's a summary of what I presented today. And again, I'm John Higgins, and this was a project proposal for improving the line of duty process.